Go ahead.
All right, good afternoon. I'm Dr. Dale Bratzler. I'm the Enterprise Chief Quality Officer here at OU Health, and I'm the University Chief COVID Officer. I'm going to give just a brief update on where we're at in Oklahoma with respect to COVID-19 with today's data, and then talk a little bit at the end about some of the variants and the news today that life expectancy in the United States dropped by a year this past year with the COVID pandemic. So lots of good news to report. Oklahoma now ranks 13th in the nation in terms of the number of new cases per day per capita. We've dropped from 103 new cases per day per 100,000 population on the 13th of January. Today we're down to 26. So a huge drop in the total number of cases per 100,000 population per day. The State Health Department just reported our numbers. There were another 800 cases today, 417,345 cases now that have been confirmed in the state, with 4,132 Oklahomans that have lost their life to this particular disease. 20 new deaths were reported today. I will highlight that when you look at the 7-day rolling average, there's been a 78% reduction in the number of new cases per day based on the 7-day rolling average, which is just a remarkable drop. The United States as a whole is seeing a substantial drop in the number of new cases per day, but not as great of a decline as we've seen in Oklahoma. Of course, Tulsa, Oklahoma County, and Cleveland County, the most populous counties, have the most cases that have been confirmed in the state. But when you look at the per capita, per 100,000 number of cases per day in the state right now, Pawnee County is number one with 110 new cases per day per 100,000 population. I put the maps in the handout that will be sent out today. I'd highlight the Harvard map, which had been solid red for weeks and weeks. It now has green, yellow, orange, and red on it. So it's dramatically changed with a dramatic reduction in the number of new cases per day in the state. One area that I am a bit concerned about is that the number of COVID tests being done in the state has dropped very substantially. Now, this is a short week with the President's Day holiday, but through today, yesterday, the state had only reported 40,000 COVID tests this past week. 15% of every test done in the state came back positive. That's now down to 6.5%, which is an enormous reduction. And then finally, hospitalizations are down also as of yesterday. Just acute care hospitalizations were down to 663, which is a 67% reduction in the number of people in the hospital since the middle of January when we hit the peak after the Christmas and New Year holidays. So all in all, very, very good news. Like I say, the one thing I am a bit concerned about is the testing is way down in the state, partly due to the weather, undoubtedly, but we need to remember that some of the reduction in numbers may be partially artificial based on just the fact that we're not doing very many tests over the past week or so. I've had a few questions this week again about the variant strains of COVID-19, and I think it's important that we remember we talk a lot about the 3 variant strains that are prominent: the UK variant, which is in the United States, the South Africa variant, and the Brazil variant. But I wanted to highlight that there have been a number of studies now showing that there are a lot of different strains of the COVID-19 virus that are going across the United States. And in fact, some people are calling these the US variants. So for instance, in Louisiana, there's a variant strain that caused about 20% of the cases in Louisiana. I think many people have heard that there's a California variant of the virus. There are at least 7 different variants in the United States that have been identified. Many of them have a very similar mutation, which affects the spike protein, but the good news is that to date, those particular variants seem to still be protected from with the vaccine that we're rolling out right now. Many of these variants have local spread, so I think it's important that everybody remember that this virus will continue to mutate. There will be new variants that develop, and there is always the possibility of spread of the virus on. I've updated on one of the handouts the key variant strains that we've been following: the UK variant, the South Africa variant, and the Brazil variant. The only variant that's been formally identified in Oklahoma is the Brazil variant. There are now 4 cases in the United States, with 1 case in Florida, 2 in Minnesota, and 1 in Oklahoma. Again, the one thing that we're concerned about with the Brazil variant is that it may not be protected as well by the current vaccines that we have on the market, and it's clearly been linked to repeat infections in people who have recovered from COVID-19 and then get infected with the Brazil variant. They can have a second infection that has been well documented in Brazil and in other countries now. But again, there are only 4 cases that have been identified so far in the United States. I think a lot of people are aware that we haven't been doing a lot of genomic sequencing of the COVID viruses in the United States, and one of the new initiatives from the federal government is to dramatically increase the number of viral strains that are actually sequenced so we can identify variant strains of the virus. I'll be happy to answer any questions about those. Finally, the last thing I wanted to highlight was some of the big news this morning that CDC released, that there's been a 1-year reduction in life expectancy in the United States in 2020. And that's very, very substantial. That's a very large drop in life expectancy, just based sheerly on the number of deaths in the United States that we've had from COVID-19. And it's been disproportionate. In other words, certain populations have been more affected than others. So in the United States, the Hispanic population has seen about a 2-year reduction in life expectancy during 2020. The non-Hispanic white population has seen about a 1-year reduction in life expectancy in 2020, and non-Hispanic black patients have seen about a 3% reduction in life expectancy. We've known for quite some time that there's been disproportionate impact of COVID-19 on certain populations of our residents. And again, I think it highlights for me that it's very, very important that we make sure that we prioritize efforts to get vaccines into the arms of those that are disadvantaged, those that are socioeconomically disadvantaged, those that may not have internet access or have easy ways to sign up for vaccine portals, to make sure that we get the vaccines into the arms of those people that have been disproportionately affected. And I've included in the handout a couple of graphics that came directly from the Centers for Disease Control that show that reduction in life expectancy. Finally, the last graphic that I put in just highlights again how very different this particular virus has been compared to usual seasonal influenza. So the CDC has a graphic that looks at data for 2020 that combines all deaths in the country from pneumonia, from influenza, and from COVID-19. And so, of course, we didn't see any cases of COVID-19 before 2020. And the only peak you see in that epidemic number of deaths occurred in 2018 when we had a flu outbreak that did increase the number of deaths in 2018. But then when you look at the graphic and you see what happened in 2020, there was this enormous increase in deaths from that combined category of pneumonia, influenza, COVID-19. And again, the vast majority of those due to COVID-19. Again, this disease is very, very different from influenza. Currently, the death rate appears to be 9 to 10 times higher from COVID-19 than it is when somebody gets sick with influenza. This is a very serious viral infection. It's had a profound impact on our country, shortened life expectancy in our country by a year just in 2020 from the COVID-19 pandemic. So again, we have to continue to take it seriously. I think all of us agree that COVID-19 is not going to go away completely. It's likely it will become what we call an endemic infection. In other words, it won't be epidemic in the future, particularly if we get people vaccinated. But every physician that we train, all of the medical students that we train, will have to put COVID-19 into their differential diagnosis in the future, particularly when an elderly person comes into the hospital with what appears to be a viral illness that's struggling to breathe or has problems with kidneys or other things. COVID-19 is going to have to be in the differential diagnosis, I think, for many years to come. So at this point, I'll stop and I'll be happy to answer any questions.
Thank you so much for that update. We do have a couple of questions from the media today. One being, how do you think winter weather is affecting the speed of COVID spread and vaccine distribution, if at all?
Yeah, so the winter weather this past week, the question is about both spread of the virus and also distribution of the vaccine, and no question about it, it's slowed down distribution of the vaccine over the past week. Many sites that were planning to give vaccine to patients had to shut down, and frankly, remember, we're still in the phase where we're focused on people that are 65 years of age and over, and this was just not the weather to have those people going out, driving their cars, and trying to get into facilities to get their COVID vaccine. So many different vaccine clinics were shut down this past week. I know both the state and city county health departments are going to be increasing the number of clinics that they have in the near future. The good news is that a lot more vaccine will be coming into the state soon. So I think we're going to see a lot more opportunities to get vaccinated. Be patient, it's coming. The weather's going to get better. We're going to hit 60 this week, hopefully, and I think the opportunities to get vaccinated are going to be there. With respect to spread of the virus, I don't know how it's going to impact. My general sense is that this weather was so cold and we had so much snow that family units stayed at home. People that you live with stayed in the house. This was not the weather that people were going out and coming together in group settings. Many restaurants and other places had to close simply because people couldn't get there. So I think it actually could potentially further reduce some of the transmission of the virus during this cold snap. We'll have to see what happens, though, once the weather warms up and people start getting active again out in the community.
And the next question refers back to the variant strains that you mentioned earlier on. You mentioned the status already of the variants within Oklahoma, but are there any limitations that exist with the data available about them?
Yeah, so the question is about the variant strains. Is there any limitation on the data that's available about them? So we don't know a lot about them. And again, I want to highlight that in the press, what you hear about a lot is the three variants that have been talked about, the UK variant, the South Africa variant, and the Brazil variant. But there are many other variants that have been identified in the United States that are actually spreading in the United States. So the good news is that at least for both the UK variant and the South Africa variant, it appears that the amount of antibody that a person will develop after they get the vaccine is effective at neutralizing the virus. In other words, they're still effective against both the UK and the South Africa variant. Maybe not as much impact on the Brazil variant, but again, there are only 4 cases that have been identified in the United States. If I were thinking about a data limitation, however, it's that we're simply not sequencing enough of the viruses that are being actually identified in the United States. And I know the CDC is trying to ramp up those efforts. I think they're preparing to do some contracting with universities around the country that actually have that capability to do the genetic sequencing of viruses. We need more testing so we can actually figure out what are the variants that are spreading in the United States. But there are more than 3.
And this next question refers also to the variant strains. Variant strains are thought to be more transmissible. What challenges could that pose for our health system?
Yeah, so I was doing a little reading about the UK variant since it's been reported to be more transmissible, more contagious. And part of the reason may be is that it infects people for a longer period of time. There was a nice study that came out of the Harvard School of Public Health that looked at how long people shed virus with the UK variant versus the other strains that had been circulating in the United States. And while most strains in the United States, you only shed the virus for 7 or 8 days typically after you get infected, the UK variant, they were finding people that were shedding virus for up to 13 days. And so that's beyond the period that we actually formally isolate people currently in the United States. If this virus is more communicable, in other words, spreads easier from person to person, then we could see an uptick in cases, particularly if we see a big increase in the number of people infected with the UK variant. So right now, again, I'll highlight that we're in a race. We're in a race against mutations versus getting vaccines in the arms of people who need the vaccine. The more vaccine we get into people's arms, the slower the virus will spread, the fewer mutations will happen, the fewer people that will be potentially exposed to variant strains. So it's really, really incumbent upon us right now to do everything we can to increase vaccination efforts.
And at this time, those are all the questions we've received, but is there anything else that you'd like to add?
I don't have any other points today. Again, you know, I gave a lot of good news today. Reduction in the number of cases, hospitalizations. I worry two things: that people will get less vigilant about wearing their mask, social distancing, and doing the things that we know that will slow the spread of the virus. We're not out of this yet, so we need to keep doing that. And then the second thing, I don't want people to think that because cases are coming down, you don't need to get the vaccine. It's very, very important that people get vaccinated at this point if we really want to get this pandemic under control.
Thank you very much.